In this digital lesson, we're going to talk about how to treat some common animal bites. So first things first, what is a bite? This seems like a silly question, but the answers to the following questions will determine what you need to be worried about and how to treat the child. A bite, strictly speaking, is a defect in the skin caused by the teeth of an animal. Let's talk about two important questions you should ask whenever you are evaluating a bite. The first question is, what did the biting? Was it a human, a dog, a cat, a snake, a bat, a raccoon, a rat, a fox, a rabbit, or something else? Yes, anything can bite you, but we're going to talk about some general concepts and common bites in this lesson. Specifically bites by humans, dogs, cats, and snakes. The second question that should be asked is also obvious. What does a skin defect look like? Or better yet, is there a skin defect? Is it an abrasion, a laceration, a puncture, or an avulsion? Now that you're armed with these two simple questions, let's say a child comes to you after a bite. What are the basic steps you should do? As with any wound, control the pain. Things will go so much more smoothly if the child is comfortable and unafraid. So, make a friend. Oral, IV, or IN medications such as Motrin, Lortab, Tylenol, and fentanyl IN can help provide systemic analgesia quickly. Topical medications such as LET, which is a mixture of lidocaine, epinephrine, and tetracaine, will help with local anesthesia, i.e. wound numbing. Next, wash the wound out, just like with any other laceration. There are two parts to cleansing the wound. First, you want to cleanse the wound surface. You can use things such as soap and water, saline, 1% povidone iodine, 1% benzalkonium chloride, or SureCleanse. Then, you want to make sure you irrigate the wound with copious amounts of saline and high pressure. You don't have to irrigate puncture wounds. While you're dealing with the patient, someone else needs to deal with the offending animal. Have the family call their local animal control for their county, or the county where the attack occurred. If you have a question, the Poison Center will be able to help with phone numbers as well as with patient management. What's next now that you cleaned the wound? What happens now depends more on what animal did the biting. For example, watch this video clip of a dog biting someone. Did you see what the dog does after his jaws have clamped down on the person? Let's watch it again. What did you notice? Not only does the dog bite, but he also shakes his head as he's biting. This is why dog bites are often complicated by broken bones and avulsed tissues. In these cases, it's usually a good idea to get an x-ray of the injured body part. Cats, on the other hand, tend to give puncture wounds rather than large lacerations. Humans are similar. Here is what a human bite looks like. As for snake bites, most people get understandably worried, especially since more often than not, they don't know whether the snake is poisonous. Just to lay to rest some old teachings, if a child is bitten by a poisonous snake, don't apply a tourniquet or try to suck out the venom. Call the Poison Center and discuss whether antivenom should be given. Usually the child's labs will need to be checked, specifically a CBC, a Chem 14, and a DIC screen, which includes a PT and PTT. It's quiz time! Yay! True or false? All bites should be closed so that they can heal by primary intention. The correct answer is false. Bite wounds are usually not closed. Here's why. Mouths are extremely dirty things, teeming with bacteria. By the way, humans have some of the dirtiest mouths out there. Even with irrigation, the risk of infection and a laceration due to a bite that has been repaired is very high. So, we usually don't close bites. That being said, there are a couple of exceptions. Bites on the face are often closed, mainly for cosmetic reasons, and only after having a frank discussion with the families about the risk of infection. The second exception is a large gaping wound from a bite. In these cases, a loose closure is often attempted so that the edges of the wound will be a little closer together, but again, the main healing is done by secondary intention. Now that we've washed the wound, what antibiotic would you choose as first-line prophylaxis? Ceftriaxone? Amoxicillin? Amoxicillin clavulanic acid? Metronidazole? Or nothing? Bites don't need prophylaxis as long as they are irrigated well. If you chose Augmentin, you are correct. So how do we prevent infection from a bite? Although there is evidence out there that these wounds do not necessarily need antibiotics to prevent infection, a lot of people still give antibiotics, and the Red Book still does recommend giving antibiotic prophylaxis. So what bacteria would you be worried about? For dogs, cats, or mammals, you would worry about Staph aureus, strep, Corynebacterium, Pasteurella, Capnocytophaga, Moraxella, Neisseria, and anaerobes. For humans, again you worry about staph and strep, Echinella corridans, Haemophilus, and again anaerobes. To cover all of these bacteria, which antibiotic would you choose? You guessed it, Augmentin. If the child is allergic to penicillins or clavulanate, your other options are cephalosporin or trimethoprim sulfamethoxazole, i.e. Bactrim, and clindamycin. Typically, prophylaxis for bites lasts for 3 to 5 days. In addition, a tetanus booster should be given if the child is not up to date for tetanus immunizations. Can you think of any other infectious agent you would be worried about? Yes, rabies! When should you be concerned about rabies? Most of the cases that you will have to think about this are with unprovoked attacks by dogs. Some other signs of rabies in dogs are changes in behavior, dragging of the hind legs due to paralysis, and, of course, the perennial favorite, foaming at the mouth. Other animals that you have to think about rabies are cats, ferrets, bats, skunks, raccoons, foxes, and woodchucks. So, how do you treat for it? It's all about prevention. All the treatments are targeted towards not allowing the virus to get a foot in the door and start replicating. So, we treat with immunoglobulin, 20 units per kilogram. It is infiltrated in and around the wound, and then the remainder is given intramuscularly in the affected extremity. Then, we give the rabies shot series. The first dose, usually 1 ml IM, must be given in a different extremity than the rabies immunoglobulin and is given when the patient first presents for care, i.e. day 0. This is followed by a series of 3 other shots on days 3, 7, and 14. If the location of the animal is known, and there is a question as to whether the animal is truly rabid, animal control can observe the animal for 10 days. If the animal shows any signs of being rabid within those 10 days, it will be euthanized, and the child should be treated with immunoglobulin and the vaccination series. Thank you for going through my digital lesson on animal bites. Hopefully this gave you an overview of what to do with the common presentation of animal bites. To reiterate, make sure you control the pain as much as possible. Good local wound care with cleansing the skin and copious irrigation of the wounds themselves is absolutely essential. Remember, your first-line therapy is Augmentin for 3 to 5 days as prophylaxis. If the child is allergic, and you can't use Augmentin, your next best choices are a cephalosporin or Bactrim plus clindamycin. Don't forget to check for tetanus status and give a booster if needed. And if there is any concern about rabies, give the immunoglobulin and start the vaccination series. If you have any questions, don't hesitate to email me. Thanks again.